The purpose of this video is to provide directions using an ethical decision-making process, the moral model. The situation begins with a patient who was admitted for surgery of a hernia repair. The operation was performed and the patient returned to the floor without obvious incident. A few days later, the patient began to develop signs and symptoms of infection, fever, chills, and poor wound healing. An investigation of the situation would be found that a sponge had been left in the patient in the operating room. Using the moral model, M-O-R-A-L, M, massaging the dilemma. Postoperatively, the patient's incision would not heal. The circulating nurse failed to perform the correct amount of sponge counts necessary during surgery. There are two options here, option A and option B. The nurse was to provide a standard of care for a surgical patient by performing the necessary number of sponge counts. And then there's option B, negligence. Omit the standard of care established by the hospital's policies and procedures. R, review the criteria. Less than a dozen sponges were required to be counted. It was a policy and procedure for 3 sponge counts to be performed during this operation. A, affirming the position. Option A was the best choice. The nurse should maintain a standard of care at all times. The circulating nurse counts the unused sponges and notes them on a form that the sponges were counted. The operating nurse is charged with the responsibility to ensure that no foreign objects remain in the body at the conclusion of surgery. The unused and used sponges must correspond to the number of sponges originally laid out prior to surgery. L, let's look back. Counting is a legal responsibility of the surgical team. Each institute has developed policies and procedures for such counts, and the count should include descriptions of the materials counted, intervals of the count, and documentations of the count's status on the intraoperative report. The responsibility for accurate sponge counts rests with the circulating and scrub nurses. There is little obscurity to the fact that objects left inside patients' bodies have catastrophic effects.